Courageous Conversations is part of the Kansas Racial Equity Collaborative. We acknowledge the importance of learning through lectures, reading, and dialogue. This aspect of learning is application. Today we have Kelechi Wright, a KU doctoral student, along with Dr. Becci Akin, an associate professor and PhD program director. They are both core collaborators with the Kansas Racial Equity Collaborative. Welcome. Kelechi and Becci, can you share with everyone the grant KU obtained and the specific work within the federal grant regarding racial equity work?
Thank you, Brandy. The grant is called Kansas Strong for Children and Families, and it's under a federal initiative known as the Strengthening Child Welfare Systems and Outcomes. And it's a 5-year grant that started in 2018, so it'll go until 2023. And we've been just really privileged to receive it and to work with many different partners in Kansas. One part of the grant, which we wrote in 2018, has to do with addressing racial equity in child welfare. And I'm going to turn it to Kelechi to explain one piece of that.
So one of the biggest portions that I had the privilege of working with Dr. Akin in is an institutional analysis focused on addressing the racial disproportionalities that the data showed was prevalent in Wyandotte County. And we partnered with the Center for the Study of Social Policy in beginning to address the history of racial disproportionality in the child welfare system within that particular county. And we were able to do a very large qualitative analysis where we were able to interview several caseworkers and administrators and parents, many different levels and aspects of the child welfare system within that region. And we were able to really look at and pinpoint many of the themes that we're attributing to the racial disproportionality for Black families involved in the child welfare system, and highlight where the racial disparities are very prevalent from the data we got from that. And so that's one of the ways that the Kansas Strong work that we're connected to has been working to advance racial equity in the child welfare system. And we'll get to continue to talk more about kind of the evolution of that work as well. So I'll turn it over to Becci.
Yeah, I would thank you for that. I was going to add two other things that have happened in this work for us. One is through the work that Kelechi is speaking about with the institutional analysis and working for the Center for the Study of Social Policy, we were inspired to develop a covenant on racial equity for our steering committee. And so we worked for a number of months with our steering committee to develop the covenant. And its purpose is really to hold us accountable for action, for making change. And so that was a really important process that I think we feel committed to. The second thing I wanted to say that we've done is we've also provided space among our research team at the University of Kansas School of Social Welfare to make sure that we're doing the work individually and as a team to address racism in our systems, which they exist in child welfare systems, they exist in academia, everywhere. And so we're really bringing that to our work as researchers.
Well, that kind of gets me into like the specifics. And so the question that we have is, how does Kansas Strong really support racial equity advancement in child welfare?
So I think we're trying to do it in a number of ways. One is the work in Wyandotte County, where we have done the institutional analysis, which really focuses on identifying, listening and centering the experiences of people who have been involved with the child welfare system, and listening to what they identify as the places where they have needs and the institution has not responded to those needs. So there's this disconnect between their experiences and what the institution is doing. So that one way is like to take that information that we have gotten from people with lived experience and to try to develop an action plan to respond so that the institution would be responsive to people's needs. Another way, go ahead, Kelechi.
I was going to also add too, I think that the type of work that we're doing, especially with the institutional analysis, is highlighting the voices of parents, which I think we all know the name of the child welfare system in itself, right? The emphasis is a paradigm in which the emphasis is on the child, whereas when you're dealing with communal families that come from communal heritage and ethnic backgrounds like Black families, children and families don't see themselves as separated. And so, and focusing on work in which parental voices are amplified and the community's voice is amplified, I think is really a big aspect of the work that we're doing in promoting racial equity. And especially when you consider that when you're operating in a system where there's such a disconnect, not just between the services and what's happening, as Dr. Akin mentioned, but also a disconnect between the services that are happening and the community itself, right? Mm-hmm. You're having a community that has its own resiliencies and strengths that has been operating for such a long time, right? And yet when you have systems that are totally disconnected from those communities, yet come in a form of enforcing, like in child welfare, mandates, policies, and procedures, those disconnects can cause a lot of harm, as we see in the data. And so I think that the kind of work that we're doing in Kansas Strong, especially in amplifying and putting those voices at the forefront, is pretty revolutionary and very different than typically the way systemic approaches are approached.
Yeah, so I would definitely agree with that. Just the fact that there is the active engagement for families who have lived experience. And so I'm actually really interested if there were any stories that were shared that impacted you personally or that you remember, right? Although you all have likely interviewed, dozens of folks, is there a specific story that kind of stands out to you?
I can share. I had the privilege of getting to interview a good number of parents as well. And I think that what really, honestly, Chanel, there's a lot of stories, but many of the ones that hit home for me was especially the stories in which the expectation was what they should leave their family members to keep the child at home. So an aspect where a father is expecting that to be able to keep the child, he has to kick the mother out because the focus is on the mother from the child welfare aspect, right? So he's having to make this decision of, do I choose my child or do I choose the mother of my child, right? And then all the financial implications for that, and especially considering his understanding of her struggles with addiction and the mental health needs. How do I abandon her in that? So those types of realities are really stick out in my mind when you think of, again, an ethnic group that has a communal perspective to break up the family unit seemingly for the sake of the child. It really does not make sense, and it does more harm. I think another story that also in a scenario that really hit home for me that kind of makes me think about the necessity of this work is two parents that mentioned after reunification happened, foster parents reaching back out to them, and these being their Black parents who were child welfare involved, and these are white parents who were the foster parents. And these foster parents, after reunification happened, are calling by the biological parent and asking to talk to the child, and the discomfort that they felt as parents because of not just the cultural differences and the ethnic differences of the racialized system we live in, but also not really knowing, are you really wanting to support me, or are you really hoping something happens so you can have my child back? I mean, the level of discomfort, you could feel it in a visceral way when interviewing them, of how, again, it's the policies and procedures that need to be in place to protect these parents, because they're legally done everything they're supposed to. They've received their children back. Now they need to move forward, and they're crying and talking about the harm that's been done of, you know, months to a year of separation from their child, and they're trying to bond with them and the trauma that's felt, and then having, you know, foster parents call them because they're feeling emotional, and then they feel like they need to take care of the foster parents' feelings and take care of their own feelings at the same time, and their child's feelings. I really think that this kind of work we're doing in advancing racial equity and supporting racial equity, again, it's amplifying these stories that you don't hear, right? Because the focus is, okay, the goals for the child and the placement of the child, but we're not hearing all the peripheral damage that's being done to a community when all of this happens.
That is such a great perspective that we never hear. So I'm really glad that you shared those stories. And my follow-up question is, the work that you both are doing, is it personally important to you? Like, why are you doing this work?
I think it is very personally important to us, and probably for different reasons, because we come at this with different perspectives and identities. So I totally recognize that, and you know, the privilege that I bring in who I am in this space. And for me, you know, I think a lot of people became aware and kind of called to action after the George Floyd murder. But I think for this work, it's important to also notice that we started this before that. And for me, it's really about humanity, and it's about being the human that I am, and believing in the humanity of all people, and that all people deserve to be treated with humanity and kindness, and that when I live, I think, from the guiding principles in my life around, if there's just injustice in one place, then it harms all of us. So, and having worked in and around the child welfare system for so long, I've seen those injustices and inequities and disparities. And there came a point, I think, for me where I had to do more about it.
I just want to say too, thinking of what Becci shared in terms of humanity, as a person of color, I bring a lot of passion towards not just addressing institutional racism that Black and Brown communities face, but also what even Becci was sharing in terms of doing work with people that make a lot of key decisions that don't look like me, and helping them to see those areas in which Black and Brown people are not treated humane, right? Highlighting those aspects of, you know, when you're in a system now where people want to say, well, you know, racism doesn't exist, or, you know, we've routed all the policies that are actually racist with the civil rights movement, but you're actually, you know, doing this work personally. It's important to me to show people the different masks of institutional racism in our policies. And so for me, I think that that's very important work, because what that does to the identity of Black and Brown people, who know that they're experiencing hard things that are unfair and are racist, but then these pushbacks you get, it's significant for me to be able to work in these aspects and show and highlight these policies really are focused in particular communities, and or certain things are done or not addressed, right, that are in favor of white communities versus, you know, Black and Brown communities, you know. And also too, I am an adopted parent. My husband and I, we have an adopted child, and there's a lot of aspects in which, and we became foster parents, and we also did adoption through the private child welfare system, and the private adoption system, excuse me, and the racism we experienced in that process, I don't even have enough time to express. And so I have a lot of passions along those lines, where I want other Black and Brown parents, I want to encourage them to become adoptive parents, but the state of the way that child welfare is and the way that the private adoption system is, I don't want to introduce them to that. It's traumatizing on many different levels. And so that's the way I personally kind of bring something, to this work as well.
Can I add a story also thank you. And this, I think, speaks to my comments about humanity. And there were lots of things in what we heard from parents that I think were really meaningful, and I had an emotional response to. And one of those was to hear about the trauma that they experienced when their children were put in the foster care system, and just like their loss and their grief, and then not feeling like they could express that safely in our child welfare system. So that was really heartbreaking. And hearing parents talk about that when they heard a baby cry and their baby was in foster care, and how painful that was for them, like that speaks to the humanity of that person, and that we're not responding to them. Another story from a parent about this was about our legal system and the representation that they receive, and how there was turnover in the attorneys that represented the parent, and that they said every time they went to court, it was a different attorney. They said the person didn't know their name, they didn't know their situation, and they were supposed to try to catch them up. And then the attorney would say something like, "Yeah, this doesn't look good," and like how terrible that would be for them. And this was one of those people, I think, Kelechi, you were talking about, like they were doing everything right, they were following the rules, and this wasn't even the parent who had who had kind of been investigated. They were trying to be there for their child, and just the lack of dignity and humanity with which the system treated them was just disturbing.
So I know Brandy has a few follow-up questions, but I do want to say that I feel like that's a warning to professionals, because we can become so like on autopilot when we do the work that we do, that instead of seeing human beings who are experiencing likely the very worst moments of their life, we see it as another case, and we just need to get through because we have that other case that we need to go to. And so I appreciate that story as well. Just the elevation of the importance of remembering that these are moments, important moments, and oftentimes traumatic moments in people's lives.
So, I'm hearing a few things before I even get into my question. So I'm probably answering my question while also asking you to clarify this question. The two things that I've heard so far is, what you're learning from this is that humanity is key. Bringing the humanness, if that's a word, to the forefront, and that voices matter, and the voices of our family, who we believe are the expert of their own lives, is key to really re-imaging what we call the child welfare system as it is right now. So those are two very key things that I feel like I'm hearing that you're learning from this. But my question is, what have you learned while implementing policy and procedure in this program? And Kelechi, I'll start with you.
Okay. I think my biggest kind of focal point in seeing what really has to be reformed in the child welfare system is there needs to be greater representation of persons of color in all aspects of the child welfare system, right? From judges to attorneys to caseworkers to, if you're having ethnic groups that are going to by nature interact with this system, there have to be people that look like them and understand their culture. And an example of how that showed up also, I think, in the study and the work that we've done is, and we were working with the Center for the Study of Social Policy, and they often refer to that in institutions like the child welfare system, there is a big disconnect, even ethnically, of caseworkers and parents of color. And they gave examples of, cases where a Black mother, for example, in her words, when interviewed, would say things like, I didn't want to be too overly emotional because then I would look like I was crazy to these white people who are evaluating me, right professionals. But then I didn't want to seem like I didn't care. So they're trying to figure out all the psychological ways in which they're perceived in a racialized system. And then, of course, by nature, the power dynamic of these people have my children. They decide if I get my child back. All that stress is on this parent. And then the interesting thing is you do many case record reviews like we did. And in this case, that caseworker actually responded and said that particular parent seemed apathetic and had no emotions, right? So you're actually seeing this total disconnect because, we intention isn't to vilify the caseworker. The question is, did the caseworker understand the parents, even ethnically, right? I think that when we see that you're in a system that's predominantly white and is interacting with many Black and brown families and not understanding, how these families operate, what are kind of the modes and ways of communication that, and though they're in ranges, we can't stereotype, there is still more of an understanding when someone represents that color. But if you're going to have systems like like child welfare, where again, that dynamic of ratio between the parent and the professionals is overwhelmingly white with Black and brown families, there has to be more people of color, caseworkers, like I said, judges, attorneys, all aspects of those levels. I was actually reading something about in another state where there certain acts that are being passed, to make sure that predominantly Spanish speaking persons involved in systems, that they have people who speak Spanish, right, in all aspects of their interactions. And they're these places in the United States and cities that are doing this, their intentionality, I think, to make sure that the people are represented in their language is something that needs to happen also with Black families as well, right? That even if we necessarily speak the same language, there's a lot of aspects of cultural disconnects that are happening, and the data shows it in the work that we do. And caseworkers are honest about that, and so I think that that's something that really has to be implemented to move forward.
Thank you for that, Kelechi. You speak to implicit bias and the importance of recognizing that, and recognizing that we all have it, and how do we address that and how do we overcome that? So I think that's real. That's real life. So thank you for that. Becci, what do you feel you learned?
So many things. What I'll highlight is, I think I've learned about the need for what I'm going to call unlearning and relearning. One area for that is around our history, that many people have not known the history of our child welfare system, have not even known the true history of this country. And so I think that's actually fundamental to us moving forward with actions that are equitable and just. So that's one thing. Another thing that I've learned, and I'm glad you brought up implicit bias, Brandy, because I started in the work of child welfare, working in policy. And so I often turn to policy first, and because I believe that we do need to change our policies. And in doing this work, I've also figured out it's not an either or, it's a both and. We need to be working at multiple levels. So that individual level where we're talking with, or we're training, we're coaching people around implicit biases or unconscious bias. And we also need to be doing organizational level work and systems level policy work. So all of the above, I think. And then the last thing I want to mention that I've learned is about the importance of these collaborative spaces where we get to have courageous conversations, where we have the space for this learning and growing and making mistakes and learning from them, because it's not going to be an event, right? We're not going to like suddenly not have racism in our child welfare system. It's going to be a process. And I think having these spaces where we can commit to that process and to that learning journey it's important. And for me, it's been reassuring and enriching and powerful.
If I could just add to that too, as Becci was talking, it made me think of, I like what you said, a multi-system, multi-level approach. And I'm a firm believer that these changes are possible, right? And I know that there's a lot of thought towards what does child welfare reform look like, and perspectives and passions surrounding it. But thinking back to what Becci shared about the humanity, when I think of and imagine a caseworker or a judge or an attorney who is of one ethnic group, who never ever interacts with the ethnic group that they're continuously enforcing policies or making decisions around, outside of a punitive nature like child welfare, I don't see how it's possible to change. And I think that even the depth that needs to happen is we really have to challenge this notion of how siloed and segregated we are as a culture, as a people, because when it comes to these professional interactions, if we don't have these interactions, and suddenly I'm your attorney, but I don't have any interactions with people of color, right? We're going to bring all those implicit biases, like she's, biases that she said. And so that's something I'm hopeful too, that persons who are listening to this will really think about in terms of the dynamics of what change, what's really needed to change too.
I don't know whether I should go on or let you keep talking. I mean, what a fruitful conversation we're having. So what's next? What's happening next with Kansas Strong? What can we expect to see?
So one aspect, I know that Becci will share as well, but with this is we are working with community members to develop action plans within Wyandotte County, especially. We really wanted to make sure that past efforts of research in which has caused a lot of skepticism and done harm in terms of just researching and leaving, our intention behind the kind of work we do. We want to make sure that we are assisting and keeping the community members at the forefront of what the reformation process looks like for child welfare. And so our intention is to build and to develop action plans where we can assist community members in holding child welfare responsible and accountable to its practices, right? We're in this paradigm in our nation where a lot of these institutions are policing our Black and Brown communities, whereas our hope is that we can create community kind of organization around communities holding institutions responsible, right, for what they're doing with our children. And so or our families too, and with our families. So that's one aspect, and I'll pass it over to Becci to talk further too.
Thanks. Well, I think one of the next steps is what we're doing with the Kansas Racial Equity Collaborative, and some of the training, the learning that people have to do. And we have a coaching program where we have integrated anti-racism practice into that coaching program. So those things at the organizational level that reach our workforce, I think those are really important. And then we also, we have to carry this forward. What we hear from the community members that Kelechi is talking about, I feel a responsibility for when I have access to administrators, to policymakers, and making sure that we're being accountable for those actions that need to be put in place, for changes that need to be made. So those are kind of lots of next steps, but those at both the organization and the policy level I wanted to mention.
Well, I personally want to thank you for your time today. I've learned a lot about what's going on with Kansas Strong, and I feel encouraged. I feel encouraged. You know, there might be times where you're thinking, oh, okay, are we getting anywhere? Are we getting anywhere? And then you hear conversations like this and you're like, yes, we are. So I can step up one more time, you know, one more day, just one step at a time. So I want to thank you and just ask, is there any final courageous thoughts to end us today from anyone?
I think that my thought is to invite people into this work. Yeah. So to invite people to be courageous themselves, to do your individual work that you need to do, which might be, you know, reading and learning and listening to podcasts and showing up at webinars and bringing up, you know, questions, raising questions in your workplace. And so I really want to invite people to start doing that, examining what's happening with themselves and within their organizations.
Thank you. Kelechi, any final thoughts?
Yeah. I would say, I know that, you know, we understand that in the landscape of where we work, that there can be a little bit of fatigue or struggle with, you know, looking at history, for example, or a lot of challenges. And this is a lot of ways what we're talking about is very politicized. But my hope is that that those listening would be courageous in staying engaged in this conversation, because even as politicized as this topic is, these are real families that are affected by the policies and procedures that are implemented within child welfare. And so from privileged positions that one might sit in, this might seem just like a political thing, or, you know, as Becci mentioned, you know, Kansas Strong work has been happening before, you know, the focus in the media on what's always been happening in communities. And so just know that, you know, families that experience a lot of the harm that's done institutionally, they need us to stay at this table. And so I just want to encourage people to stay courageous in that, and that you might not have been responsible necessarily for what happened in the past, but we are responsible for what happens in the future. So I encourage you to stay engaged and do the hard work.
Chanel?
I work with all of you, but I am inspired and am just so pleased with this conversation and just the challenges that have been put forth for all of us regarding staying engaged, right? And having those uncomfortable conversations, which oftentimes are very courageous because we don't want to have them. So just again, kudos. Thank you so much for the work that you're doing, Kelechi. Thank you, Dr. Akin. And we're just all going to continue doing this important work together. So.
All right. Thank you all. This was wonderful. I really appreciate your time today, and I appreciate all the work that you do. We are a great team.
We are a great team.
Thank you.
Thank you.